Okay, so now I'm going to demonstrate how we do our weekly cleaning maintenance on our SetAview machine. So I'm going to go to my vet lab station, click Instruments, and go to SetAview, Settings, Clean, and we're going to turn off our SetAview machine. So that's going to go ahead and power off. Next, so next I'm going to open our door. I'm going to take one of these alcohol pads. I'm going to clean this window, as well as inside the machine. I'm going to clean this window. Next I'm going to take this off, clean it with an alcohol pad. And if we're doing weekly cleanings, there shouldn't be too much discharge or anything on these. Next, I'm going to go ahead and clean this little pusher arm. Make sure that I push it in and out. Okay, so I'm going to get a new alcohol pad. I'm going to go ahead and clean the optics. I'm going to clean it gently because I don't want it to scrape. Okay, next, I'm going to go ahead and remove the waistband. This is where all the gross stuff comes. I'm also going to remove this. I'm also going to remove this. I'm going to go over to see. I'll just hose them off. This is some distilled water that I'll use. If they were really gunked up, I could use more of a scrubbing to clean it. I'll just set this over here to dry. And dry these all out. Okay, next I'm going to go ahead and bring it back over here. Next on my machine. I'm going to put these in. Back in like that. That's gonna go back in like that. I'll clean this arm back here. And put next. Okay, and then I'm gonna go ahead and put the cartridge holder back in. That kind of magnets back in there. Then I'm gonna close the analyzer door. Tap done. I'm just going to go ahead and power back on. And that's how I do a weekly clean on our SetAview lab. Okay, so now I'm going to demonstrate how to do an ELISA test. Today we're going to do a SNAP CPL test on one of our patients. So I'm going to go ahead and insert my patient information into our vet lab station. Okay, and then I'm going to prep my sample and discharge here. So I have my serum sample that I'm going to go ahead and run this on. So we took this out of the fridge. It has to sit outside of the fridge in room temperature for 20 minutes. So that's already done and it's ready. Oops. Yep. My bad. Okay, and so I'm going to fill this little microtainer tube. We're going to do 4 drops of the conjugate, and then I'm going to do 3 drops of my serum. Go ahead and recap that. I do go ahead and invert this 5 times. And then I will go ahead and fill this little well that's in the CPL SNAP test. You can kind of see that my sample is getting sucked up into the SNAP test. Once I get that little bit of blue that's into this view window, then I'll go ahead and snap it. I'm just going to wait for that. Okay. And I'm going to come over here. Go ahead and click start timer on my test. It's going to, it has to incubate for 10 minutes, and then once it's done, it'll go ahead and alarm, and then I can insert my results. But when I'm doing a snap test, I always remember, so blue means 4, so I'm going to do 4 drops of the blue, and then red is 3, has 3 letters in it, so I'm going to do three drops of my sample. So, but yeah, and then once that's done, we'll go ahead and see what the results are. Okay, so my alarm is going off, so I'm going to go ahead and do my sample. I'm going to go over here and click my patient. So looking at my comparison, so my control dot is on there, which is good. I want to always make sure that my control is on there. If there's not a control dot on there, then this test may be not functioning correctly, so I would have to do it again. But it is there, and then there's a little, the second dot is also present, but it's not as dark or darker than the first dot. So I'm going to go ahead and click that it's normal. And then yeah, so my results are going to print out, and I'll go ahead and give those results to my doctor, and she'll go ahead and call the client.
Brandy is pregnant. I will be mixing the formalin and blood today for her. So I have 1 ml of anticoagulated blood, and then I'm going to do 9 mils of formalin. We're just going to put this in the test tube, making sure that we don't get any of it anywhere. And we're going to add our whole blood. And cap our tube and gently invert. And then Brandy will be continuing the procedure.
Okay, so Kayleen went ahead and mixed the formalin and anticoagulated blood into a test tube for me. So I'm going to go ahead and fill the other one with distilled water. And I want it to be level with where the other test tube is at, because I'll use it as my balance in the scale, or in the centrifuge. Go ahead, put that on tight. So I'm going to go ahead and invert this a couple times. Open my centrifuge. Put them opposite each other. And then I'm going to go ahead and centrifuge the sample for 5 minutes at 1500 RPMs. So I'm going to go ahead and start that. And then when that's done, we'll come back and we'll do the next steps. Our tested samples are done the same again, so I'm going to go ahead and take them out. Place it in my rack. Go ahead and get my 12 ml syringe ready. Go ahead and take my cap off. I'm going to discard my supernatant into this container so I can dispose of it properly later. Okay, so I'm going to go ahead and use a 3 ml syringe, get down a little farther. There we go. Just be careful not to disrupt anything. Okay, then I'm going to go ahead and put a drop of methylene blue. I'm going to go ahead and mix my sample. Okay, then I'm going to go ahead and put up a small amount. I'm going to go ahead and put a drop onto that. I'm going to go ahead and grab a cover slip. Okay, so I'm going to go ahead and look at my sample under the microscope. And with this test, I'm looking, the modified Knox test is going to take a sample of anticoagulated blood, and I'm going to see if there's any microfilaria present for heart rhythm. So I'm focused on 4 right now, and I'm going to go to 10. I'm just going to look back to the sample. And I do not see any microfilaria present, so I would say that this patient's blood sample is negative for heart rhythm. And that's how we would do a modified Knox test. Okay, so first I'm going to do a fecal flotation. I'm going to take about 2 grams of my feces sample here. I'm going to put it into my container.
Yeah. Oh, you want me to read it?
Okay, next, since I'm using a commercial fecalizer called Fecal Salt, I'm going to put that in my solution. Go ahead and pushing that down. Okay. And I'm going to fill it up with Fecazole until I get a meniscus formed at the top. I'm going to go ahead and grab a microscope slide or a cover. I'm going to go ahead and put that on my tube and let that sit for 15 minutes. And then I'll come back and read the slide. Okay, so my fecal flotation is done sitting. So I'm going to go ahead and take my cover slip off. Go ahead and place it on a slide. Okay, and so that slide is ready to be read under the microscope. Okay, next I'm going to do my setup for my fecal flotation with centrifugation. So again, I'm going to take 2 grams of my sample. Put it in here. Then I'm going to be using my commercial fecalizer Fecazole. Add that to my sample. Okay, next I'm going to go ahead and put a lid on this. I'm going to go ahead and put it in the centrifuge. At 1500 RPMs for 10 minutes. Okay, so my fecal flotation with centrifugation sample is done. So I'm going to go ahead and remove it from the centrifuge. And put my counterbalance back. I'm going to go over to the sink. I'm going to take off my cap. I'm going to go ahead and use Fecazole.
So my office is back here where you can put your backpack and your binder if you want to.
Go ahead and fill all the way up to the top. I'm going to go ahead and put a cover slip on top.
Who's that?
And then that's going to go ahead and sit for 15 minutes. Okay, so my fecal flotation with centrifugation is done. Cover slip, so I'm just going to go ahead and pull the cover slip off and put it on my microscope slide. And then now this slide is ready to be read. Okay, so next I'm going to do a direct smear. So I'm going to take some of my sample.
Yeah, just use it for a while.
Put it on the slide. So I'm going to take a small.
Come on.
Put some Fecalzole on there, which is our commercial fecalizer we use. And I'm going to go ahead and mix it around a little bit. I don't want it to be as even as possible on this slide. So that's a bigger piece. I'm going to go ahead and remove that off my slide. Okay. I'm going to go ahead and put my microscope slide on top. Okay, and then now the slide's ready to be read. Okay, so next I'm going to do my setup for sedimentation. So I'm going to go ahead and grab 2 grams of my fecal sample again.
So Xander, this is Jessica. She's actually a technician. She's also a doctor.
Okay, and then I'm going to go ahead and fill this it up with some water. Okay, and so next I'm going to go ahead and strain my sample.
Good luck. It does happen. Let's see here. Okay, cool. So I'm going to go for the next one.
So that.
And I can show you how we work like first.
Okay, so next I'm going to go ahead and put it in here. I'm going to go ahead and grab my lid on. Okay, so my sedimentation setup is done in the centrifuge. So I'm going to go ahead and take it out, get rid of my counterweight. So with this, I'm going to dump off the excess material. I'm going to go ahead and use a pipette. Of the excess liquid off. I'm going to go ahead and pull off the top layer of the sediment. Go ahead and set that there. I'm going to go ahead and grab a slide. Just going to go ahead and put a drop of that on there. Get rid of my pipetter. And I'm just going to go ahead and grab a cover slip and put that on. And then my sedimentation microscope slide is ready to be read. Okay, so here I have my 4 fecal testing slides set up. I just wanted to talk a little bit about why we do each one and the benefits of each one. So the fecal flotation uses a specific gravity that is higher than most common parasite ova. So that way we're able to see the majority of parasites. If there are any heavier parasites, sometimes they won't show up, so that's something that we have to take into consideration. The fecal flotation with centrifugation, it's more sensitive than just the flotation, so it's almost like a step up, and it allows us to recover more eggs in less time. The direct smear looks for eggs, larvae, and trophocytes. It may not detect low parasite loads, so that's a problem. It may not be accurate enough. And then sedimentation is used when the suspected ova of parasites are too large to be recovered with the standard flotation. So those are the benefits and kind of the issues we come into when we're trying to figure out which kind of fecal testing we want to have performed. Okay, so we're going to go ahead and do a free catch urine sample on Rose. Come on, baby. So we want to collect it first thing in the morning, ideally when she has a full bladder, and then I want to catch a midstream sample just to reduce the risk of contamination from her vulva. Come on. So I do need a ladle. I'll put my dog on leash, and then I have a 6 ml syringe as well. Come on, Ram. Let's go. I'm gonna let it go for a little bit. I'm gonna go ahead and put my ladle underneath. There we go. See you, room. Okay, then I'm gonna go ahead and take my 6 ml syringe, suck up my sample. I'll go ahead and put it in there, dump the rest. And I'll go ahead and label my urine, run it for a urinalysis, and we'll check her pH. And that's how we do a free catch on a patient. Okay, so I'm going to discuss the different methods of cystocentesis that we can perform. So a blind stick, we use that a lot in dogs. So one of our doctors will put the patient on their back in a trough, and then the doctor will put some alcohol, and then where the alcohol pools, they'll go ahead and poke the bladder, just in the area where the bladder would be. And then also a palpation/isolation technique. So we use that a lot in cats when I have them in lateral recumbency. The technician can go ahead and palpate the bladder and then trap it between their fingers, and then poke it that way. There's also ultrasound guided. We don't have an ultrasound here, but using an ultrasound can help you specifically place where the bladder is and then poke the bladder that way. So yeah, that's the methods that we can use for cystocentesis. Okay, so we're going to do a cystocentesis on our patient Aster here. So Kayleen has a syringe for us and then also some alcohol. So I'm going to go ahead and hold her for Kayleen. And Kayleen's going to go ahead and palpate the bladder and isolate it to collect the sample. So I'm just going to scruff the cat, grab her back legs and her tail, and pull back so she's able to palpate the bladder. I know, baby, it's okay. And she's going to put some alcohol on it. So she has it trapped between her thumb and her other fingers. So go ahead and put her needle in. It's okay, baby. I know, I'm sorry. Okay, so there's our sample. So now I'm going to go ahead and label that sample, and we'll run a urinalysis on it. So this is good for anytime we're wanting to do a culture and sensitivity on a patient that's having chronic UTIs. We like to do a cystocentesis, so it's more of a sterile sample, and then we can culture it as well. So, but that's how we do a cystocentesis on a kitty. Okay, so now I'm going to discuss everything that I need for catheterization of a patient. So I have some gauze here, some chlorhexidine solution, which I'll use to clean the penis once I extrude it from the sheath. Some sterile lubricating 6 ml syringe, some sterile gloves, and then I have 3 different kinds of catheters here. So I have a red rubber. This is more flexible, can be used for one-time placement. It can be used in males and females. And then polypropylene catheter, which is what I most commonly use. So it's more plastic, more rigid, so I have to be careful when placing it in the urethra that it doesn't cause any irritation. Usually one-time use as well. It can be used in males or females. I have a Tomcat catheter here as well, so we'll use that in cats that are blocked to make sure that they're, once they're unblocked, to make sure that they're still urinating correctly. It has this little plate at the end which we can suture in place so that it doesn't fall out. Not shown here, there's also another kind of catheter called a Foley catheter. We use that for indwelling catheters. It has an inflatable bulb that can be inflated to keep the catheter in place. Sometimes they can be too short to use in male dogs, so we have to be careful with that, but that's the most common one to use in indwelling catheters. But yeah, that's a little bit about catheterization and then the types of catheters that we can use. I went and catheterized my patient Otis today because he has some hind end paresis, so he's not able to urinate on his own. So I'm going to go ahead and clean his penis first. I'm going to get that ready. So I do have some sterile lube here. I have some gauze sponges, so I'm just going to do a little dollop of that on there. 3.5 French. That should be adequate size for him. I'm just going to go ahead and put that in there for now. I'm going to run my catheter through my lube a couple times. So I just cleaned the end of his penis with some disinfectant solution of chlorhexidine. And so I extrude his penis out, clean it, and then I'm going to place this catheter into his bladder. Just keep going in. Okay, and I'm using a polypropylene catheter for this. I'm going to attach my 6 ml syringe. I'm going to go ahead and get rid of the first couple millimeters of urine. And then I'll go ahead and drain the rest. And since I'm emptying his bladder, I'm going to continue to drain urine. If I was just getting a urinalysis sample, then I would just get like 6 mils and that should be fine. Okay, so I went ahead and emptied his bladder, so I'm just going to go ahead and remove the catheter. Good job, buddy. And I just go ahead and I just take everything and put it into my gloves like this. And then I go ahead and throw it away. So yeah. Okay, so this is Aster. I'm gonna go ahead and do a ear cytology on her because we noticed some discharge coming from her ears. So I'm gonna go ahead and check and see if there's any mites present. So I have some sterile saline drawn up in the syringe. So I'm gonna go ahead and put some on there.
Where's the lube? Oh, there's the lube.
I know, baby. Okay, and so now that I have a sample, I'm going to go ahead and just roll it on the slide. You okay? I need a little bit more. Come on, baby. Okay, so I'm going to go ahead and label this one. This is the left ear cytology. I'm going to go ahead and do the right ear now.
Yes. So,
Oh, yes.
got attacked by a big dog earlier? Yeah. So if it comes on drain. Yes.
Okay, and then I'm going to go ahead and roll it on this slide.
Here and a little here. So we put a
Right.
drain in there. So the bottom, you can drain the bad stuff out of here.
Okay, and then I'm going to label this right ear. And then I'm going to go ahead and take this to the lab and I'm going to go ahead and do some staining. Okay, so here I am with my ear cytology swabs.
Okay.
So we went ahead and did a swab on both ears, and the reason why we did this swab on this cat was because we noticed some discharge. So a lot of times if we have cats that come in and we're worried about possible ear mites, we'll do an ear swab to check for them. So that's what we're doing. So I am gonna heat up our slide. I'm just gonna briefly run this over. And I'm gonna do the same with this one. Okay, next I'm gonna go ahead and dip them in the stain. So I'm doing staining with Diff Quick stain 1 through 3, and I'm gonna do 12 dips in each stain.
What you said?
Sarah, go ahead. Okay. I'll leave it here. Yes. Okay. Okay, and then I'm gonna shake off the excess. And then I'm gonna set that aside to dry. Then I'm gonna do the same thing with my right ear slide. And then I'll go ahead and let these dry until they're completely dry, and then I'll go ahead and read them under the microscope. Okay, so now that the slides are dry, I'm gonna go ahead and look at each one individually. So I'm gonna start at 4 power. Basically on this power, I'm looking for ear mites. And then I'll work my way all the way up to 100 power. And at that power, I'm looking for any yeast or bacteria or things like that. So I'm gonna work my way through that. I don't see any mites, so I'm gonna go ahead and move up. Okay, so now that I'm in between my 40 and my 100, I'm gonna go ahead and take a drop of mineral oil and put that on my slide. I do see quite a bit of bacteria on here and just a few yeast. So yeah, so once I'm done reading this slide, I'll go ahead and do the left ear slide the same way that I did the right ear slide. Okay, so we have a kitty here that has some hair loss on his side. So we're gonna go ahead and take a hair sample of that. So I'm gonna go ahead and clean the area first with some alcohol. It's okay, buddy. And this just takes, hopefully cleans the area of any other debris in his fur. It's okay, buddy. With some alcohol. Hold on, buddy. And so with doing a fungal culture, I can either do a swab, I can do a scraping, or I can do hairbrush, but today I'm gonna, or use a toothbrush to take some samples, but I'm gonna go ahead and pluck some fur. I know, buddy. And so in my sample, I'm just gonna go ahead and place that in there like that. He's okay to get up to me. Just like that. I'm gonna go ahead and take another little sample. And so I'm just trying to get in the periphery of that hair loss. I'm just gonna go ahead and place it in here. And I'm using a Sabra dextrose culture plate for this. So I'm just gonna kind of press it into my culture plate. And that should be good. And I'll go ahead and label this and let it set and see if we grow anything. Okay, so we have our fungal culture here. It's been sitting for a couple days. So I'm gonna go ahead and look at it. And it does look, go ahead and take a look at it. So I don't see, it's not fluffy like I would expect fungi to look like. I think that that's just some bacteria in there. So I would say that this SDA plate is negative for a fungal culture. But I'm going to go ahead and put some on a microscope slide. And we'll look at it under the microscope as well. Okay, I'm going to do a drop of some blue stain on here as well. Okay, so I'm going to take off my lid. ahead and cut this a little bit. In the center of my score, I'm going to go ahead and push down. There's my sample. So go ahead and put it on there. Okay. Next, I'm going to go ahead and come over to my microscope. Okay, and I'm going to look at a low power first.
I'll just keep that by my desk. The other ones, they're not falling asleep. Today I was able to voice. Last time I didn't. So today I was able to voice.
So I'm looking at this slide. I do see my hair sample on here that's present on my microscope. But I don't see any fungal spores or anything like that. So yeah, I would go ahead and say that this culture on this patient is a negative fungal culture. We're going to go ahead and perform a skin scraping on our patient, Scrat here. So we would perform a skin scraping if there's any hair loss, any sort of inflammation or redness on the skin that the doctor is wanting to test a site or a lesion for. So the area that's chosen, so he has some balding here. He also has another spot on his neck. So I'm going to go ahead and take a sample of this today just to make sure that it's not any ringworm or mites or anything like that. So I'm going to go ahead and prepare my blade and my slide. So I'm going to use a 15 blade. I'm going to go ahead and take it out of the package. I'm going to dull my blade by running it along this inside part just for a couple seconds. This is just helping to dull the blade a little bit. I'll put it back in there for a second. I have some mineral oil here, so I'm going to go ahead and take the cap off. I'm going to put a drop on my slide, just like that. And then I'm going to put my blade and I'll just dip it in the mineral oil, like so. Okay, so I'm going to go ahead and scrape his lesion. And I'll go ahead and put my sample on my microscope slide, like so. And then I'll go ahead and look at the sample under the microscope and see if we see anything. Okay, so now I'm looking at my skin scraping slide under the microscope. So I'm on the 4 power right now. And I'm just looking for any mites. If there were any mites on this scraping, they would show up on this field. But I do not see anything at all. And next I'll go up to 10, see if I see anything. And since this is a superficial skin scraping, basically I'm just looking for mites. I could do more of a deep skin scraping if I wanted to get more into the cells, a little bit deeper. But yeah, I don't see anything on this slide. So yeah, but that's how we would do a skin scraping and then read it under the microscope. Okay, so here we are. We're going to do a necropsy on this rat specimen. Dr. Stephanie Cleveland is going to perform the necropsy. So we have all of our protective equipment. So we're wearing gowns, we have gloves on, also a hair bonnet, and then a mask with some eye protection on it. With doing necropsies, we perform necropsies to check for any genetic abnormalities, any pathogens that could be present in the patient and why they died, and then also looking for cause of death if it's unknown. So we'll go ahead and get started then.
Great. So the first thing when you have your specimen is to look at for exterior changes that could show us what happened, you know, wounds, things like that, abnormal dentation to his teeth, looks pretty normal here. make sure there's nothing, no ruptured eyes, anything that could give you a hint as to how the patient died. But he looks pretty good externally. So now that we've done that, we basically start in the belly and then we work our way to the chest cavity, because if there's something ruptured in the belly, we don't want it to contaminate our samples in the chest. So, okay, so I'm gonna go ahead and put the scalpel blade on the handle for her using an instrument so I don't cut myself, and then I'm gonna go ahead and hand that to her. Okay. And so when we are approaching the belly, we would just want to make sure we cut upwards so we don't get anything that we want to sample. But basically we make a little bit of an indent here, tent the skin, and just watch your fingers. Perfect. And then we're going to just gently, could you hand me the forceps, Brandy? And then basically we're going to gently just get the skin off so we can see the muscle belly underneath. And then we kind of go from there. We have a very thin muscle in the rat, so we want to be very careful not to puncture it yet, so we get to see it. Which I made a little nick, but that's okay. Almost there. And then sometimes we gotta peel the skin back a little bit, just kind of, so we can see a little bit better. Thank you, Brittany. That's excellent. Just trying to get that skin away. All right. Okay, so now once we get in here, we do just kind of a general look at the intestines, kind of see that they're all intact. This guy actually was frozen before we got to see him, but so some of that can change our perspective on things. But the gut here looks very intact. We'll just go through and we start identifying his organs, kind of move that gut to the side. You can see his major aortic artery, the caudal vena cava right there. And then you have his colon right here. And then we'll just move it over to the side, try to find his little kidneys. Here's his stomach right here. Looks like he had a little food in there. And there's a kidney. So kidney is a very good organ that we can take a sample of, so we'll probably be doing that today because we can look for nephritis or issues with that kidney that could have resulted in kidney disease. So since it's a tiny rodent, we'll probably just take a little slice out of here, about half the kidneys amount. But okay, and then we just open it up. So in architecture, here's a little bit damaged from the freezing process, but you can kind of see down here, here's our ureter right here, where it goes to our ureter. It's kind of hard to see in this little guy, but you can see the opening, and there was some fluid that came out once we got to that. All right, Maester, let's go on to look. So the gut looks pretty uneventful, but what we're going to do is we're going to take a little culture from the gut and see. Oh, here's his little pancreas right there. It's actually a pretty big pancreas for this guy's size, and that's actually a good organ to take for histo. So we're going to just take a little sample. I'm going to go ahead and grab a sample container for histopath. And we don't want to touch want to be very gentle with the tissue, and then we don't want to touch the formalin with our instrument. There we go, because it can affect our culture samples. And set this aside. I'll actually go ahead and label it with our patient, the date, patient name, and then where the sample's from. And set that aside. We are in our chest. There's our heart, right there. And then we got our little tiny lungs right over here. Kind of looks like the liver, but you know it's the lung because you're in the chest. So the lung is actually what we're going to also take another sample of. We're going to be looking for pneumonia, fungal infections, those kind of things. And we usually want the lower lung field for that. And we're going to take our culture of the lung as well. I want to make sure that I label this properly as well with the date, patient name, and then area where we took the sample from. Like so. And then I'm just gonna get another sample. Brandy's gonna get our culture swab ready. All right, now we're gonna just take a culture of that lung. So I'm gonna section off a sample so we get some of the internal lung parts too. And Brandy's gonna get our sterile swab. She's gonna hand that to me and then open the collection area. And I just rub it all over this piece of tissue. Should get as much bacteria from it as I can. And then this part just gets discarded. We're just looking for fungal or bacterial infections in that lung. And then I'll go ahead and take this. And label it with my patient name, where we took the sample from, and the date. And then when I send all these samples off, I'll fill out the accession form with the age of the patient and things, other details. And then I'm just... So, we already have our suture here. So I'm gonna take... And, yep, we're just gonna close that body wall. That way we can send him for disposal. And we'll send off our samples, and usually they come back in anywhere from 7 to 10 days, depending on the samples.
Okay, now I'm going to talk about rabies suspect handling. So when handling a suspected rabies case, people should only handle that suspect if they have proper training to do so, and if they have rabies pre-exposure prophylaxis, so the rabies vaccination. Protective gear, so when handling a suspect, we want to make sure we have protective eyewear, a mask with a respirator, a gown, and then some waterproof gloves as well. So when we have a suspected rabies case, the doctor will perform a euthanasia after a 10 days rabies hold if there was a bite. And then the head of a dog or cat will be sent off to the Washington State Lab for diagnostics. If we have suspected rabies of like a larger animal, like a cow or a horse or something like that, just the brain needs to be sent off. So with shipping the sample, I live in the state of Washington, so the head has to be cut off of the cadaver and then sent in. It has to be placed in a sealed bag and then placed in another sealed bag, so it's double bagged. And then it's placed in a secondary container. That secondary container then goes in a shipping container, and then around the secondary container there are ice packs. The specimen does have to be refrigerated and shipped overnight. And with the shipping container, it does have to be labeled category B, biological substance, and then it has to have a diamond next to that with UN 3373 on it. The rest of the body that isn't the head has to be double bagged in a cadaver bag and then sent off to a company for general cremation. But yeah, that's rabies suspect handling and then how we take care of the body. Okay, so first Dr. Todd's gonna go ahead and clean the vulva with some chlorhexidine solution. I'm gonna go ahead and hold the tail out of the way so it doesn't introduce anything into the area. He's gonna uncap his sterile swab, and then I have some sterile saline drawn up for him in this 3 ml syringe, so he's gonna go ahead and use that. It's okay, baby. And he's gonna insert the swab at a 45-degree angle first, and then vertically into the vagina, and then take a swab. And then he's gonna roll the sample onto our 2 slides. And then when those slides are done drying, I'm gonna go ahead and stain them, and then I'll go ahead and read them under the microscope and see what stage of estrus that this pet is in. I have my dry vaginal cytology slide here. I'm gonna go ahead and stain it using Diff Quick Stain 1 through 3. And I'm gonna do 12 dips into each stain. So I'm gonna go back. 12. I'm gonna dump off the excess of the Quick Stain 3. Then I'm gonna go ahead and set it here to dry. I'm gonna let that dry completely, and then I'll look at it under the microscope to see what stage of estrus this dog is in. Okay, so I have my vaginal cytology slide. It's stained and dried and ready to go. So I'm gonna go ahead and put it on my microscope. I'm using the 10 power first, and I'll put that into focus. And I'll go up to 40. I do see lots of epithelial cells. They're not anuclear yet. There's some that are quantified. So there's also a lot of red blood cells, but only a few neutrophils. So I would say that this patient that belongs to the slide is in proestrus, and probably like a later stage of proestrus. So with looking at the stages of estrus under the microscope with anestrus, I'm looking for primarily intermediate and parabasal cells. There might be some neutrophils and red blood cells, but there may not be. Also, the signs that I would see in my patient would be that there would be no secretion, she's not receptive to a male, there's no swelling or anything because her reproductive tract is at rest. In proestrus, I would see that my patient would have a really swollen vulva. There would be some reddish discharge coming from her vulva, and she would attract males, but she wouldn't want to mate with them. And there would be a mix of parabasal, intermediate, and epithelial cells. And as proestrus is progressing, there's a shift from the epithelial cells becoming more non-quantified. There would also be lots of red blood cells and lots of bacteria, which I do see a fair amount of bacteria in here as well. And I don't see very many neutrophils. The next stage is then estrus. So her vulva would still be swollen, but instead of the reddish discharge, it would be pinkish or straw colored. And at this stage, she would attract males and be receptive to males for mating. But at that stage, there's a lot of squamous epithelial cells, maybe cornified. There would be no neutrophils and only a small amount of erythrocytes. So I don't think that she's quite in estrus yet, but she is close to going into estrus. And then the last one is meta-estrus, which is there's no swelling or discharge coming from the vulva any longer. She's no longer attracting any males or anything like that. And then there's now non-quantified squamous cells. So a lot of times in meta-estrus as well, there's a lot of debris on the slide that I would see, and I don't see that yet either. So yeah, I would say that my patient is in proestrus according to the slide, and that's how we would do a vaginal cytology and then look at stages of estrus under the microscope. Okay, so now I'm going to do cross-matching on a donor and recipient animal. So I have my blood drawn in 2 serum separator tubes and then 2 EDTA tubes, a donor and a recipient for each. So I'm going to go ahead and centrifuge those. those are gonna go for 5 minutes and then we'll come back and do the next steps. Okay, so my samples are done spinning, so I'm gonna go ahead and put the centrifuge. I'm gonna have to use my hemostats to get my purple tops out, so I don't want to invert them. Here's that one. And then here's that one. Okay, so let's start with my serum. So I have some plain red tops labeled donor recipient. So I'm gonna go ahead and I'm gonna go ahead and put the plasma from each one into a plain red top. Like so. I'm gonna do the same with my recipient. I'm using a new 1 ml syringe. Okay, so those are done. I'm gonna go ahead and set those off to the side. Next, I'm gonna go ahead and take decant the top of my VTHT tubes. Like so, I'm just pulling off the excess fluid that's at the top. And then next I'm going to go ahead and put 2 drops of my sample here at the bottom into a plain red top tube. Up 2 to 3 drops of that. This tube is labeled donor as well. That one. And I do the same with my recipient. Side seal there. Plain red top again. Okay, next I'm going to put some sterile saline in these. Add the same amount of sterile saline to my donor one. And I'll go ahead and centrifuge my samples at 3,500 RPMs, 3,400 RPMs for 1 minute. And then once that's done, I'll go ahead and take off the top of that sample again. I'll go ahead and do 3 more drops of that, the cells that are at the bottom, and another red top, add more serum, and then I'll repeat, or add saline, put it back in the centrifuge for another minute at 3,400 RPMs, and then I'll do that another time. So I'm going to do a total of 3 times the erythrocyte washing. So yeah, I'll wait till that's done, we'll continue the process. Okay, so I just did my final erythrocyte wash, so I'm going to go ahead and remove my samples from the centrifuge. I'm going to go ahead and discard my supernatant again. Recipient. Okay. This is my recipient. So then I'm going to go ahead and take 0.02 mils of my erythrocyte suspension. And I'm going to place it in a new tube. Okay, so I have my 0.2 mils of my sample. I'm going to go ahead and place that in there in my new tube. Oops, roll away from me. I have 0.98 mils of sterile saline that's already pulled up. I'm going to go ahead and place that in here. Okay, so that is my finished recipient sample. Go ahead and move that out of the way. Go ahead and do the same thing with my donor sample. Supernatant. Okay, and I have my new test tube labeled donor. I'm going to take 0.02 mils of my erythrocyte suspension. panels of the saline to my new tube. And I'll put that out of the way. Okay, and then we'll go ahead and do the next steps. Okay, so now I'm going to demonstrate how to put together a major cross match. So I'm going to take 2 drops of the recipient's serum and 2 drops of the donor's cell suspension. I'm going to go ahead and do that. Two. That. 2 drops of my cell suspension. Okay, so this is my major cross match. I'm going to go ahead and set that off to the side. And it is labeled major. I'm going to go ahead and do a minor one as well, where I'm taking 2 drops of the donor serum and 2 drops of the recipient's erythrocyte suspension. No. Just the antic. And 2 drops of the recipient erythrocyte suspension. 2. Go ahead and set that off to the side. Okay, next I'm going to go ahead and set up how to do the controls. Okay, so I'm going to set up the donor control first. So I'm going to go ahead and take 2 drops of the donor serum sample and 2 drops of the erythrocyte suspension and mix that into a new test tube that is labeled donor control. 1, 2. To the side. Those. Next, I'm going to go ahead and do the recipient control. So it's the same thing, I'm just using the recipient samples. So 2 drops of the serum and 2 drops of the erythrocyte suspension. Okay, now I'm going to go ahead and set that off to the side. Okay, so I have my tubes. They've been incubating for 30 minutes. So I'm going to go ahead and put them in my centrifuge. Centrifuge them for a minute at 3,400 RPMs. Okay, and then when that's done, we'll go ahead and do the next steps. My tubes are done. I'm going to go ahead and take them out. Here. Okay, so I have my major cross match here. It does look like it is hemolyzed. It does look like there's some agglutination in there as well. So I would say my major cross match, they're not a match. My minor one, it's pretty much the same thing. There's a lot of hemolysis. So, and next I'm going to check my controls. So there's not as much hemolysis in this one. These two patients are not a match due to us doing the manual cross matching. So yeah, that's how we would